Umbilical hernia is a common medical condition characterized by the protrusion of abdominal contents through a weakened area or defect in the abdominal wall near the navel. It is most commonly observed in infants but can also occur in adults. We will delve into the causes and nature of umbilical hernia, shedding light on its prevalence, risk factors, and potential complications. Anatomy of an umbilical hernia. The umbilical region, commonly referred to as the belly button or navel, is an area where the abdominal muscles and tissues converge during fetal development. Normally, these structures close after birth, forming a strong and intact abdominal wall. However, in some cases, the closure is incomplete, leading to a weakness or defect in the abdominal wall, allowing organs or tissues to protrude. This is known as an umbilical hernia. Prevalence and risk factors. Umbilical hernias are relatively common in infants, particularly in premature babies. The condition affects about 20% of newborns, with a higher incidence in certain populations. Factors that increase the risk of developing an umbilical hernia include: A. Premature birth. Premature infants often have weaker abdominal walls due to incomplete development. B. African or African American descent. Studies have shown a higher incidence of umbilical hernias in individuals of African or African American descent. C. Family history. A family history of umbilical hernias can increase the likelihood of an individual developing the condition. D. Obesity. Excessive weight and abdominal fat can put additional strain on the abdominal muscles, increasing the risk of herniation. E. Pregnancy. Pregnant women, especially those who have had multiple pregnancies, are more susceptible to developing umbilical hernias due to the stretching and weakening of the abdominal wall during gestation. Causes of umbilical hernia. The primary cause of umbilical hernias is a weakness or defect in the abdominal wall. This weakness can occur due to several factors, including: A. Incomplete closure. During fetal development, if the abdominal muscles fail to close completely around the umbilical opening, it leaves a weak spot in the abdominal wall, making herniation more likely. B. Excessive abdominal pressure. Increased pressure within the abdominal cavity can push organs or tissues through the weakened area. Factors contributing to increased pressure include obesity, chronic coughing, constipation, or lifting heavy objects. C. Age-related muscle weakness. In adults, weakened abdominal muscles due to age-related factors can contribute to the development of umbilical hernias.